Which of the following substances is often included in cardioplegic solutions to prevent calcium overload during reperfusion? A. Magnesium. B. Sodium bicarbonate. C. Calcium chloride. D. Glucose. Answer: A. Magnesium. Explanation: Magnesium is included in cardioplegic solutions to help prevent calcium overload during reperfusion. It stabilizes cellular membranes and prevents excessive calcium influx into the myocardium, which could otherwise lead to cell injury or arrhythmias. Which of the following factors most influences the duration of myocardial protection during cardioplegia? A. The type of surgical procedure. B. The concentration of potassium in the cardioplegic solution. C. The patient's body temperature during surgery. D. The level of anesthesia used. Answer: B. The concentration of potassium in the cardioplegic solution. Explanation: The concentration of potassium in the cardioplegic solution plays a critical role in the duration of myocardial protection. Higher concentrations of potassium cause the heart to arrest for longer periods, thus allowing for extended myocardial protection during surgery. Which of the following is an advantage of warm blood cardioplegia over cold blood cardioplegia? A. It leads to a quicker myocardial recovery after surgery. B. It is more effective in reducing myocardial oxygen consumption. C. It is less likely to cause postoperative arrhythmias. D. It requires less time for the heart to be arrested. Answer: A. It leads to a quicker myocardial recovery after surgery. Explanation: Warm blood cardioplegia can lead to faster recovery of myocardial function after surgery due to a more gradual rewarming of the myocardium. This method allows the myocardium to wake up more smoothly from the arrested state, reducing the risk of ischemia-reperfusion injury and improving postoperative recovery. What is the role of calcium in cardioplegia-induced myocardial protection? A. It helps to depolarize the myocardium and induce systole. B. It is excluded to prevent excessive contraction during the ischemic period. C. It causes myocardial injury by increasing metabolic demand. D. It is used to stimulate myocardial recovery after surgery. Answer: B. It is excluded to prevent excessive contraction during the ischemic period. Explanation: Calcium is excluded from cardioplegic solutions to prevent myocardial contraction during the ischemic period. The absence of calcium helps to keep the myocardium in a relaxed, non-contracting state, reducing metabolic demand and preventing injury from excessive contraction. Which of the following is a major risk associated with inadequate myocardial protection during cardiac surgery? A. Increased incidence of stroke. B. Myocardial infarction and cardiac dysfunction. C. Decreased wound healing. D. Increased incidence of respiratory failure. Answer: B. Myocardial infarction and cardiac dysfunction. Explanation: Inadequate myocardial protection during cardiac surgery can lead to myocardial infarction or irreversible myocardial injury. This can result in poor cardiac function postoperatively, with long-term effects on the patient's health. Proper myocardial protection ensures that the heart survives the period of ischemia and minimizes postoperative complications. Which of the following is true about the use of warm cardioplegia during cardiac surgery? A. It is typically used to induce rapid myocardial arrest. B. It is used primarily to rewarm the heart after surgery is completed. C. It can increase the risk of arrhythmias after reperfusion. D. It is less effective in providing myocardial protection than cold cardioplegia. Answer: C. It can increase the risk of arrhythmias after reperfusion. Explanation: Warm cardioplegia, while beneficial for faster myocardial recovery, can increase the risk of arrhythmias after reperfusion. The warming process can lead to electrical instability in the heart, particularly if the myocardial recovery is not well controlled. What is the main purpose of using potassium in the cardioplegic solution during cardiac surgery? A. To improve myocardial contractility. B. To induce myocardial depolarization and arrest. C. To enhance coronary blood flow. D. To increase the oxygen supply to the myocardium. Answer: B. To induce myocardial depolarization and arrest. Explanation: Potassium is used in cardioplegic solutions to induce myocardial depolarization and arrest. High potassium concentrations disrupt the normal ion gradients across the myocardial cell membrane, causing the heart to stop contracting and allowing the heart to be protected during surgery. Which of the following is a key disadvantage of cold crystalloid cardioplegia compared to blood-based cardioplegia? A. Increased risk of myocardial reperfusion injury. B. Greater risk of postoperative bleeding. C. Reduced ability to restore coronary circulation. D. Higher likelihood of arrhythmias during reperfusion. Answer: A. Increased risk of myocardial reperfusion injury. Explanation: cold crystalloid cardioplegia, while effective in arresting the heart, has a higher risk of reperfusion injury upon the return of blood flow. Blood-based cardioplegia, on the other hand, provides some nutritional and oxygen support to the myocardium, potentially reducing the extent of reperfusion injury. Which of the following factors most affects the success of myocardial protection during cardiopulmonary bypass? A. The patient's body mass index. B. The duration of myocardial ischemia. C. The type of surgical procedure being performed. D. The level of anesthesia used during the procedure. Answer: B. The duration of myocardial ischemia. Explanation: the duration of myocardial ischemia is a crucial factor in determining the success of myocardial protection during cardiopulmonary bypass. The longer the myocardium is deprived of oxygen, the higher the risk of damage. Proper myocardial protection, including the use of cardioplegia, aims to minimize this ischemic time and its detrimental effects. Which of the following best describes the induced hypothermia technique used during cardioplegia? A. Cooling the body to very low temperatures to decrease metabolic demand. B. Maintaining a normal body temperature to avoid arrhythmias. C. Cooling the heart only during the reperfusion phase to prevent injury. D. Inducing mild cooling of the heart to prolong myocardial arrest. Answer: D. Inducing mild cooling of the heart to prolong myocardial arrest. Explanation: induced hypothermia during cardioplegia involves cooling the heart to a mild degree, which reduces myocardial metabolism and allows the heart to remain in a state of arrested contraction for an extended period. This cooling protects the heart from ischemic injury during surgery.